Okay.
Now we'll look at the muscles that act on the leg and foot. We'll start with the iliopsoas. Its origin is the iliac fossa and the bodies and transverse processes of the lumbar vertebrae. Its insertion is the lesser trochanter of the femur, and its action is to flex the thigh and the trunk. Next is the tensor fascia latae. Its origin is the iliac crest, and its insertion is on the proximal lateral tibia. And its action is to abduct and flex the thigh. Next is the gluteus maximus. Its origin is on the iliac crest and the posterior sacrum and coccyx. Its insertion is on the gluteal tuberosity of the femur and the fascia lata. And its action is to extend the thigh laterally. Next is the gluteus medius,
Which
not shown here.
it's not visible. It's usually it just shows a little portion,
Ah, there you go.
but here we have a little bit of it.
Okay. Its origin is on the lateral surface of the ilium. Its insertion is on the greater trochanter of the femur, and its action is to abduct the thigh. Next is the adductor longus.
Sorry.
There you
it
go.
is.
Its origin is the pubic crest and the symphysis pubis. Its insertion is on the linea aspera of the femur, and its action is to adduct the thigh. Next, we'll go to the quadriceps group, starting with the rectus femoris. Its origin is the anterior inferior iliac spine. Its insertion is the patella and the tibial tuberosity, and its action is to extend the leg and flex the thigh. Next is the vastus lateralis. Its origin is the greater trochanter and the linea aspera of the femur. Its insertion is the patella and the tibial tuberosity, and its action is to extend the leg. Next is the vastus medialis. Its origin is the linea aspera of the femur. Its insertion is the patella and the tibial tuberosity, and its action is to extend the leg. Next is the hamstring group, starting with the biceps femoris. Its origin is the ischial tuberosity and the linea aspera of the femur. Its insertion are the proximal tibia and fibula, and its action is to flex at the leg and extend the thigh. Next is the semitendinosus. Its origin.
It normally goes right here. On this model, it tends to fall off. So we'll proceed with the
Hold it on
origin.
here. Yes, tendinosus. Its origin is the ischial tuberosity. Its insertion is the proximal medial surface of the tibia, and its action is to extend the thigh. Next is the semimembranosus. Its origin is the ischial tuberosity. Its insertion is the proximal tibia, and its action is to extend the thigh. Next is the gracilis.
the arm and the leg.
Its origin is the symphysis pubis and the pubic arch. Its insertion is the medial surface of the body of the tibia, and its action is to flex the leg and adduct the thigh. Next is the sartorius. Its origin is the anterior superior iliac spine. Its insertion is the medial surface of the body of the tibia, and its action is to flex the leg and rotate the thigh laterally. Next is the gastrocnemius. Its origin are the condyles of the femur. Its insertion is the heel of the foot, and its action is to extend the foot. Next is the soleus. Its origin is the proximal fibula and the medial border of the tibia. Its insertion is the heel of the foot, and its action is to extend the foot. Next is the tibialis anterior. Its origin is the proximal lateral tibia. Its insertion is the tarsal and the first metatarsal, and its action is to flex and invert the foot. Last is the extensor digitorum longus. Its origin is the lateral condyle of the tibia and the proximal 3/4 anterior fibula, and its insertion are the 2nd through 5th phalanges, and its action is to flex and evert the foot and extend the toes.